When they came out of the meeting regarding the results of the CT scan, my doctor and my wife at the time and some family members sat me down and they said, "Rick, you have a tumor in your transverse side of your colon that has migrated to the descending side of the colon, and it's about the size of a grapefruit." Came back with a diagnosis of stage 4 or worse, which is rare. Got that part of that surgery over with me, and immediately within about a week and a half of recovery started chemo. During the chemo, they thought, well, we're going to get a handle on this, but at that juncture they had told me I probably have less than 4 months to live. We had kind of come to the grips that we were going to go to Mexico. And we really weren't going to Mexico for any other reason but to try to enjoy what was left of my life. And we just didn't know what to do. We just didn't know what to do. And ironically, we stumbled upon a young man. He mentioned to me, he goes, well, you know, my dad met a gentleman here, a fellow by the name of Dr. David L. Walker. And my father was in dire straits with cancer. And he saved my father's life when everyone else had said there was no way he'd survive. Lo and behold, we got his name, we got his address, and we just went over and stumbled in him. He said, I'm not offering a cure, but I'm telling you that there is other alternative means to save your life, to give you another chance, to give you a fighting chance. And consequently, this is where it gets really bizarre. You talk about all the strange things that happen in your life and déjà vu and what God can do for you and what the next guy standing next to you can do for you. He had the same cancer I had. He went through a battle himself. He went through a lot of anguish. He went through a lot of suffering. And he went through surgery and chemo and such, very similar to me. Well, he cured himself. He did a lot of research. He did a lot of just plain old American, good old-fashioned homework and ingenuity. And he came up with some processes that at least made a difference. They weren't 100% of a cure, but they were 86 out of 100. And the best that I could come up with in the Western world on medicine that could save my life was 14 out of 100. My weight was the big thing. My weight started going up. My stamina, my strength. Crazy things like my hair coming back strong. That's why my hair is long. It's a tool that I can use to show, even after losing a big piece of it, you can get your hair back. My teeth, look at my teeth, look at my eyes, they've all improved. My skin, I have just about zero fat. I haven't been this strong and in this physical shape in quite a few years. Well, I don't know if I could ever say those exact words. It probably wouldn't do any good to say I am absolutely cancer-free. I don't believe anybody's ever cancer-free. But I do know what the statistics are showing. I do know what the chemistry, the physiology is showing. And at this point right now, I'm about as clean as you can possibly be. I like to think I'm cancer cured. I like to think I'm cancer-free. My CEA which is basically a blood test, glorified, that can tell you where you stand. As we speak, I don't believe I have any activity. I don't think there is any. Everybody's telling me I don't, from even the Western establishments. When I go back for verification, their comments to me is, whatever you're doing, keep doing it. We don't know what's happening here, but all we know is it's better. And every time you come back, it's better. And we just have to tell you, keep doing what you're doing. So to answer your question, I'm probably about 80%, maybe 90% sure that I'm cancer-free. I feel it. My emotions tell me I'm cancer-free. My brain, my heart, and everything tell me I'm cancer-free. I believe it down deep that I am. And you know, the facts are what they are. I look in the mirror every morning and I kind of grin and giggle and say, hey dude, you whipped it. You know, you're a testimony here, and I feel real good about it. So that's the best way for me to answer it. That's probably the most prudent way.